Gauteng's emergency services say there has been a sharp increase in the number of emergencies since the festive season kicked off. In the first 24 days of December alone, over 48,000 emergency incidents were recorded, with Johannesburg seeing more than 16,000 of these calls. Health MEC Nomantu Nkomo-Ralehoko visited the Emergency Medical Services Center in Midrand to assess the situation. This as response teams were dealing with the escalating cases. Newzroom Afrika's Veronica Makhoali has more.
It's that time of the year when holiday cheer meets crisis management, and already the numbers are alarming. Compared to last year, Gauteng has seen a noticeable increase in road accidents, medical emergencies, trauma cases, and tragically, even suicide. Gauteng EMS reports that from the 1st of December, trauma cases alone skyrocketed to 11,274.
We are seeing in all these categories, whether either be medical, either being inter-facility transfers, either being trauma incidents, gunshots, motor vehicle, we are seeing that our numbers currently are already surpassing the same period last year, which means that there's a high increase in emergencies out there that are basically are happening, and meaning that our communities either they are not that vigilant, and it means that we need to get a message out there to say, be more cautious, be more safe, be more responsible.
Statistics show that emergency service calls can surge by up to 25% during this time, placing pressure on healthcare facilities already stretched thin.
We need vehicles on site so that when we divert you from a specific clinic and we're taking you to a hospital or to a hospital to a clinic, there is an ambulance that is on site, that is waiting, so that we ease up the pressure that we're having, especially on the trauma unit side. All our wards are going to be packed, accident and emergency areas are going to be packed, so we're looking into other alternatives so that people must not feel that they are being chased away in the hospital or they are not attended to. Everybody that gets into any facility must be attended to.
The Health MEC admits this surge has put the system under immense strain, but insists there's a shift in how they're tackling it.
That's all that the citizens want. They need an urgent response, and we have all the vehicles that you can see here. We have seen this last one that I've showed you, which is an emergency ICU ambulance itself. We have 21 ICU ambulances in the province where we can take you immediately and treat you in an ambulance, not wait until you go and then you die on site. The other issue that we're doing now, we're working with all the stakeholders. Forensic, you've seen they are here. We'll be with them on site until the 31st and the 1st of December, because we feel that when there's an emergency that must be attended to, a person has died, he has been gunshot, and that person died immediately on spot, we can't wait for hours for an ambulance and for a forensic team to come. Everybody will be working as a collective, and it's something that I'm proud about it, because before we used to work in silos as a Department of Health.
With more calls and EMS teams stretched thin, concerns have been raised about delays in response times.
When you call an ambulance, make sure that you give us clearly your name, your contact details, and be vigilant of where are you. Because we've seen that people who will register will say, we need an ambulance for a motor vehicle accident. And then our agents will then ask, where are you on the N1? And we realize that it's a problem. We end up having a delay right there of dispatching our resources to the right direction of the N1. And those are the things that we need to improve as a community to help us as well, so that we can improve our response time. So as EMS, we are trying all our best to make systems available so that we can know where are you exactly. And as you phone the 112 number, make sure that you give your correct location.
Officials are urging all those in the festive spirit to be more cautious and avoid adding to the strain. For Newzroom Afrika on Channel 405, I'm Veronica Makhoali at the Gauteng Emergency Command Center in Midrand.